The Ministry of Health is tonight raising an alarm over a surge in maternal deaths among girls between the ages of 10 and 19 years. 104 deaths were recorded among girls in that age group in 2021, compared to 31 deaths in 2020. The situation, among other related issues like teenage pregnancies, HIV and AIDS, as well as gender-based violence, forcing the Ministry of Health, in partnership with the Ministry of Education, to come up with a guidebook seeking to help adolescents understand more on such topics. Let's get more from our very own Raquel Mwigai.
Time and time again, the country has always been left with unanswered questions regarding the high number of teenage pregnancies recorded every year. But further away from those statistics are the number of deaths recorded arising from pregnancy-related issues among girls aged 10 to 19 years. Government data stating that 104 such deaths were recorded in 2021 compared to 31 deaths recorded in 2020, the highest numbers being among 15 to 19-year-old girls compared to their counterparts aged 10 to 14 years. A situation driven by lack of access to maternal healthcare services and unsafe abortions.
Many of them unknowingly make unguided and poor decisions on matters regarding their sexual and reproductive health. This is mainly due to the lack of accurate information on issues around sexual and reproductive health.
And it is a shame that in most Kenyan homesteads, the three-letter word, the S word, is a taboo.
Well, this is just a drop in the ocean in the long list of issues facing the adolescents, ranging from HIV and AIDS, sexually transmitted infections, gender-based violence and drug and substance abuse. The ministry is keen to change the narrative using this guidebook for adolescents.
Me as a parent of an adolescent, this book makes my life easier because it's a reference document that I can be able to share with my son and daughter to ensure that I convey the correct information, factual, not only information that I can be able to get from other sources, which may be misleading.
A sigh of relief for teachers who have found themselves tasked with imparting knowledge on sexual and reproductive health in the best way they know.
It has not really been easy because, with their growth and being in a world where they really do not know where they're going. It's the teacher now who knows, and therefore, and again, because of the pressure of time with the academics, they've not really had so much time to get into the topics that are covered in this book.
The book has a number of titles ranging from healthy relationships and communication, abstinence, sexually transmitted infections, mental health, and drug and substance abuse, among others.
I think the situation won't be the same anymore because right now we have wide knowledge about the idea.
Tutaweza kusaidika vile vile na kupata njia nzuri za kutuwezesha kujikimu maishani mwetu.
And we are going to disseminate this booklet to all schools in this republic through physical or manual books that we have already published, and also through a website where students are able to access soft copies of this through social media whenever they are not in school.
With the reference material gap already sorted out by the Ministry of Education, the baton has now been passed to parents, teachers and adolescents to sit down and have candid conversations regarding these issues that affect them the most. Raquel Mwigai, Citizen TV, Nairobi.